Yeah. So Mrs. Emma France. Send the information in the case was write a letter to Mrs. Emma France, who is the mental health social worker at Hope Process Counseling and Therapy, to Market Street. Okay. So this is fine. Now we can finish up with this. Yeah. Good presentation. Good presentation. Right. Fine. Rajya, Lakshmi, this is better than the previous one. Why are you putting capital letter for here? It's okay. Careful, careful, careful. Why ex-smoker? E. Why capital? Okay. Right. Mrs. Emma France. Fine. Good presentation. Mental health social worker. Mental health social worker. Mental health social worker. Mental health social worker. Right? This W, right straight. Then Hope Process Counseling and Therapy. Where is that? Huh? Hope Process Counseling and Therapy. Where is that? So social worker is in the street. Huh? Where's the name of the facility? Hope Process Counseling and Therapy. Hope Process Counseling and Therapy. Hope Processing Counseling and Therapy. I made a mistake. I'm correcting it. Mistakes are done. So Hope Processing. Okay, here is better. To Market Street. Muswell Book. Muswell Book. Oh my God. It's Brook. Huh? How can you do this mistake? NSW. I told you NSW means New South Wales. Okay. 11th August 2013. Dear Mrs. France, you're leaving too much space here. This space is okay, this space is okay, this space is okay. Later. But this is why so much double space? Hmm? This addition. This additional space is not required here. This is too much. Regarding Mr. Oliver Harry, where is R? Invisible. Okay, write clearly. Regarding, no need space before. Space is needed after, not before. Mr. Oliver Harry, date of birth 25 May 1982. Fine. Mr. Oliver Harry, who was diagnosed with hypertension and depression, and hypertension, depression, and suicidal thoughts. Suicidal tendency. Diagnosed with hypertension, depression, and suicidal tendencies. Hypertension, depression, and suicidal tendencies. Okay, requires immediate assessment. Is this urgent letter? Okay. He came to your clinic because that time hypertension was unstable. That time it was urgent, but now, is it urgent? Are you sending him by ambulance? Or any death risk is there now? Then why you have used urgent? Is there anywhere something called urgent? I don't see anything. Presenting problems today. Came to the clinic because hypertension became extremely unstable last week. He and his wife on the advisor are considering early retirement and applied for a DSP, disability support pension. He has potential for suicide. Where is the question of urgent? I don't see any urgent. Okay. Came to clinic because hypertension became extremely unstable last week. So you have treated him last week till now. Last week he came with extremely unstable. Last week. So where is this week? Last week to this week, 1 week. Still is emergency. Then what are you doing in the clinic? What is the doctor doing in the clinic? Still urgency for 7 days? I don't count on that. So just check it out. And why are you writing a letter to the Emma France? They're writing for counseling and therapy. Okay. Counseling. If so emergency, why you send for counseling? You directly give treatment. No? So you have to think about these things. You have to think very carefully. Okay. So when you wrote emergency, total things will be changed. Okay. Requires immediate assessment. Therapeutic counseling. Counseling and therapy, that's all. Assessment you have already done in the hospital. Doctor has already done. Okay. Fine. So this immediate assessment. Who will do immediate assessment? Assessment will be done by a doctor. Okay. And you are writing to a nurse. You are writing to a whom? You are writing to whom? Mental health social worker. Will social worker assess immediately? Not no assessment only. And you are saying immediate assessment. Hello, Rajya Lakshmi. Rajya Lakshmi, are
Yes,
you
sir.
there? Are you there or are you on duty?
No, I'm at home.
Okay. What I'm asking is, do you understand what I'm telling now?
Yes, sir. This one is I got different letter. So just I
Hmm.
tried to write because before I didn't see like this letter.
Hmm.
I don't know how to write. Actually, this social worker means I made it myself. I have written. So that's the reason that day itself I told you to just can you correct it this one because I don't
Okay.
know.
No problem, no problem. So what I'm telling you is, so a nurse cannot, a social worker, a nurse only cannot assess.
Okay.
So social worker, what she will do? Correct or not? So that statement, this sentence is wrong. Counseling is okay, management is okay, but assessment is not. That's fine. Okay. So you're writing this. So France is mental health. Okay. So you're writing to the mental health social worker. Fine. So this you can remove. Therapeutic counseling and management from your list. Okay. (1982), 2013, 92, 2002, 2012, 31 years age. 31 years age. 31 years age, a person has 22 years old daughter. I don't understand what is this writing. My God. I'm surprised. I'm surprised. I don't know. That's why I don't take letters like this. But what to do? I'm helpless. I don't know what exactly. Because I want you to tell me, Rajya Lakshmi, this. I don't know. I don't want. I did not want to put this one on the board actually because it takes somebody else's name. But okay, that's different thing. Because the question has come, I have to speak. I cannot leave it in between, and I cannot cancel the show. Right now, I'm asking. The patient's name is Oliver Harry. Is it correct? Rajya Lakshmi, I want you to say yes or no. That's all because
Yes,
you have
sir.
gone through the patient's name is Oliver Harry, right?
Yes.
Okay, the date of birth is 1982, right?
Yes.
And today's date is 2013 year, right?
Yes, sir.
Okay, this is the reason why I tell you, confirm the letters if you are getting from somewhere. Okay, with me before. Send the case notes to me and then give me. Okay, this is 1982. Date of birth, right? Correct or not?
Yes, sir.
Then today's date is 2013, right? present date 2013 is today's date. This year, current year. Okay, current year is 2013. Date of birth is 2000. So, how many years old is this person? Now, let us see. So, I don't know. This is what is called research. So, calculator. I don't know
32
mathematics.
years.
What would I don't know mathematics. No, I don't trust my brain because this is a very important thing. No? We want standards because we are talking on internet. So this is 1982, 2013. Okay. 2013, 2013, 2013 minus 1982. I don't know if I'm wrong, tell me anything. 1982, okay, is equal to 31 years of age. That means this person, Oliver Harry, is the patient and he's 31 years of age. 31 years age. So that is age is equal to 31 years. Okay, fine. Till there it's okay. Now coming to the point, if we move forward, he's telling married, supportive wife, 2 children. Okay. Son is 15 years old. Son is 15 years old. That means he got son at 31 minus 15. That means his son was born at 16 years of age. I don't know whether. Did you notice this? Is that Oliver Harris' son is 15 years old?
Yes, sir. I also noticed, but why I have written no, because the different. I didn't bother about the age.
Okay,
I
fine.
have look out how to write to like this letter is coming. How I will face. Course. That's the reason I have written.
Good. So 22 years old daughter. Son is 15 years old, and daughter 20. Actual daughter should come up and son should come down because age is bigger than this. Okay, daughter is 22 years old. So if we see here, so 31 minus 22. It's shocking for me. I was shocked. 9 years. So he was a father at 9 years. That is what I'm surprised. So you can understand the authenticity of the letter. So other points, okay, no problem. So fine. So this simple thing is not observed. So you have to be very careful such things. Okay. We don't want to go into other things. Right. So therapeutic counseling and management from your facility on 11 August 2000. August. Is this a small letter or capital letter, Rajya Lakshmi?
Capital letter, sir.
You took a hammer and beat it on the head or what? Huh? What? You are angry with A, took a hammer and beat it on the head? How can you do that injustice? Capital letter, you made it dwarf. Okay, you mute your phone, otherwise I will go on talking. So on 11 August 2013, Mr. Harry was presented with suggestive symptoms or symptoms suggestive of? Better, symptoms suggestive of. Mr. Harry was presented with symptoms suggestive of. Mr. Harry was presented or Mr. Harry presented? So he was so helpless. Yeah. Unstable hypertension. Okay. So we can say came to the clinic. He came to the clinic. Not he was brought to the clinic. Okay. So you cannot say was presented. He presented. Finished. He came to the clinic. That's what the case note says. So presented. On 11 August 2013, Mr. Harry presented with symptoms suggestive of. Symptoms which suggested, that is meaning. Symptoms suggestive of. symptoms suggestive of extremely unstable hypertension. Is this symptoms? It's a presenting problem. It's not symptom. Question mark is not there. No? Question mark is not there. Who presented with extremely unstable hypertension. That's enough. Who was diagnosed with, okay, who hypertension, okay, that is correct. But here who presented with extreme symptoms suggestive of, not symptoms, these are not symptoms at all. Okay, these are not symptoms. It's already clear. Presented with extremely unstable hypertension. That's what you have to write. It's not symptoms, it is not suggestive. Remove all these things. Presented with, straight away hit the button. Shoot the bullet. Mr. Harry presented with extremely unstable hypertension since last week. Not since last week. Came last week. He presented last week. That's the point. It's not since last week. Since last week, why will he wait till extremely unstable hypertension means he will wait at home for 1 week, then come to you hospital or what? Okay. Present on 11th August. Today is 11th August. What is this confusion? Today's date is what? Today's date is 11th August. You're writing today. And he came last week. So he did not come on 11th August, my dear. This is totally wrong. This is totally wrong. First of all, it is not today. It's last week he came. Last week, comma, Mr. Harry presented with, last week, Mr. Harry presented with extremely unstable hypertension. That's all. Not since last week. Last week he presented. Okay. And suicidal thoughts. Either already you wrote presented, then again here has been presented. What is this? Finished. There ends the matter. Full stop. One presented is there. That's enough. Okay. Therefore, the psychiatrists are considering early retirement. He and his wife, on the advice of his psychiatrist, are considering. Who is considering? He and his wife are considering. They are thinking because advice. Psychiatrist advised early retirement. Early retirement. Okay, therefore, early retirement was. Therefore, early retirement was advised, recommended by the psychiatrist. Okay. Full stop. Therefore, early retirement was recommended by the psychiatrist. Okay. And applied for a disability, early retirement. That's one point. And applied for disability support pension. Application for, next sentence is up. Okay, I'll show you there only, it will be easy for you. Okay, applied. So this can be written as application for disability.
Hello?
Hello, Dr. Sarah. I'm in a session actually. You can tell in few words.
Sure.
I'm in the middle of a session. Give me in short and sweet. Just fat.
Oh, no, it's okay. It's okay. Do you think, can we have a lecture today, if you don't mind, please?
I did not actually plan, but it is now 9:15, so we can have 2 hours time is there, so we can have 11:30 usual time if you are interested. Otherwise, no problem.
Yes, that's perfect. That's absolutely fine with me. Thank you so much.
Okay, dear.
Thank
Application for disability support pension. Application for disability support pension was submitted. That's it. So application was given, was submitted for disability. Application for a disability support pension. A pension, sorry. A disability support pension was submitted. How did I know? I did make mistake because absent-mindedly I did. Then afterwards I saw this A. Application for a pension, yeah. Disability support pension was submitted. Control C. So like that you have to make sentences. Initially, Mr. Harry was diagnosed with severe depression and anxiety disorder. Diagnosed since 2006 or diagnosed in 2006? He has had a depression since 2006. Having depression for a long time is okay, but diagnosed since 2000 until now, not finished. Since 2006 means that is starting point until now. That is the meaning. Diagnosed is a one-time action, 1 minute action, finished. There ends the matter then and there. You cannot use the since with it. Mr. Harry has had a depression and anxiety disorder since 2006 is okay. Has had means had that time and now also. Till now it is there. That is has had, you can say present perfect and prolonging. If you say was diagnosed, it should be in 2006. If you say has had depression, then you have to say since 2006. Was diagnosed in 2006. Or change the sentence entirely, change the tense entirely, and not was diagnosed, but has had diagnosed, present perfect tense. Then you can say since. Give me a minute. So, present perfect, say diagnosis, diagnosed, 1 minute action, one time action. It's not prolonged process. Okay. What type of process is it? Is it one time action or prolonged or continuity is there? Diagnosis, how many months you will do, how many years do you? Then you will not use since. The since is for prolonged things. I have been working as a teacher since 1991. Prolonged things. Since 2006 or for the last 33 years, 35 years. So that's very important. Diagnosed, prescribed. Okay. One-time action. One-time action. So you're not supposed to use like that. So since no, in 2006, diagnosed with severe depression and anxiety disorder in 2006, which has been, depression is treated. Depression is treated totally, which has been effectively managed with. Okay. So previous treatment, ECT, antidepressants, unsuccessful. Electroconvulsive therapy and antidepressants, unsuccessful. Okay. So treated with electroconvulsive therapy and antidepressants are commenced. Are commenced when? 2006 are commenced. They were started when? Present tense or past tense? 2006. How can you say are commenced? Were commenced. 2006 is how many years back? How can you say are commenced? Are commenced means present. If it is 2000, this year is 2013. So if it is in 2013, you can say are commenced. He had hypertension for 2 years, which has been effectively managed with Norvasec. Okay, antidepressant. What is the spelling of antidepressant? Spelling antidepressants, ANTS. Did you not see here ANTS? DEPRESS, ANTS, antidepressants. ANTS. This is not E, this is A. Antidepressants. S, where is S? Huh? Antidepressants were commenced. He had hypertension for 2 years. Hypertension, which he had for 2 years, has been effectively. He had hypertension and has been effectively managed. What do you mean by that? He had hypertension past, has been effectively treated in present. How can you? Huh? You can say was effectively managed. Past some problem is there and present you are managing. How? Huh? A serious tense problem, my dear. Serious tense problem. Was effectively managed with Norvasec. 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 Okay. Right, 10 mg daily. Okay. Space between 10 and mg. Okay. Socially, comma. Why do you want to write socially? Is that necessary? Harry lives with his wife and 2 children. He's a hard drinker and ex-smoker. How many times I told you, don't use the word drinker, don't use the word smoker. You're not a new student. Huh? If new student writes these mistakes, then okay, I can understand. You have attended sessions earlier. He's a hard drinker and ex-smoker. Hypertension 2 years, takes a Norvasac. Hypertension 2 years. That means still hypertension is there. Still hypertension is there. Takes a Norvasac. 1 minute. He has attended private psychiatrist since 2008. 2006, 2006, 2008. So increasing order. That means this is 2011. Now this is 2013. So now also he has that problem. Hypertension for the last 2 years. Takes Norvasac. Then why did you say he had type hypertension? He now also has hypertension. So this is okay. This has been effectively managed. This is okay then. This is the mistake. Okay. He has had hypertension. Present perfect. It's quite some time. He has had hypertension, not for 2 years, for the last 2 years. Okay. He has had hypertension for the last 2 years, for which where is the subject? He has been taken. For which actually the sentence, what you have to write is, okay, I'll rewrite the sentence. Bring for the last 2 years there, so that hypertension and which will be side by side. That is called up. Okay. Opposition. Opposition. Nouns in opposition. For the last 2 years, remove what that which is coming in between hypertension and which is separate. For the last 2 years, he has had hypertension. Now you can write which is related to hypertension, not years. For the last 2 years, he has hypertension, which has been effectively managed with blah, blah, blah. The other things are okay. So now it is correct. So like this, if you write, that is fine. For the last 2 years, comma, he has had hypertension, which has been effectively managed with Norvasac. 10 mg daily. That's it. Just adjustment. Tense, present tense, not past tense. Socially, Mr. Harry lives with his wife and 2 children. he is hard drinker. Where is A? A hard drinker. Okay, fine. First of all, drinker you should not use. So then, ex-smoker indicates that he was a hard drinker during his 20s and 30s. When he was 20s and 30s, when he was in 20s and 30s, now also he is in 31. Huh? 31, no? Right? 31 only. Okay. So there is something constructive. Okay, leave it. So, hard drinker is that during limited use of alcohol to one beer, Sunday dinner with the family. Earlier, he was a hard drinker. He is not a hard drinker. That means you stated wrongly. Earlier, he was. You forget the confusion regarding dates. He was a hard drinker, but not now. Now he limited. He drinks only one beer, that too on Sunday during the dinner time with the family. So now he is not drinking that much. Now he is not a hard drinker. How can you say that he is a hard drinker? Totally wrong statement. He was a hard drinker. Now he is not drinking. So that is not a problem now, no? You have given wrong statement there. Right? Though excessive consumption of alcohol during the previous 2 decades. Okay. Like that one, that's separate. Currently consumes only 1 beer per week. That's it. That if you want to write, you can write, but that is not a serious problem, so no need to write. Ex-smoker. Okay, now not smoking. And what is the problem? Right. Not close to remaining family members. 2 younger sisters live nearby but rarely get together. Okay, fine. Based on the aforementioned circumstances, come an ongoing assessment. Not necessary. Because social worker will not do assessment. That is for the doctor only. She will see the signs and symptoms and say that the doctor, and doctor will follow it up. Psychological support and appropriate action plan would be extreme. Very nicely you have written. Beneficial to enhance Mr. Harris' condition. Wonderful. In case, comma, put a comma here. Any additional information is required, comma, please do not hesitate to contact me. That's fine. Yours is sincerely. Why S is a capital letter? Why there is no comma here? Registered mental health nurse. No need this much. Registered nurse is enough. You're a registered mental health nurse. Okay. New York medical practice. New York, YORK. Okay. Registered mental health nurse. Okay, let it be like that. North York. YARK. North York medical practice. Okay. Not New York, North York. Okay. 11/8. Today is 11/8/2013. Okay. Okay, fine. According to the information given, these are okay. This capital letter is not necessary. Here you put a comma, that's better. The word limit. Why you are not writing in these 3 lines? You cannot leave like this. You have to write here 1, 2, 3 lines. You must write. Okay. Otherwise, they'll think that you have closed the letter. It's not fine. You cannot leave 1, 2, 3, 4 lines between 2 paragraphs. So this you can write here itself. 1, 2, 3 lines. Okay. Fine. So till here it's okay. So here is missing. So it's something like 160, 165, maximum 170 words. Okay. Fine. Improve your quality. Improve your quality. There is no doubt regarding that. You have done something well, but you are a little confused. No worry. Do it well. And submit your letter. And Ashwini is making the list. I'll follow the list. Okay. So if you people are not available also, I'll correct and keep them. No problem. Rajya Lakshmi. Yeah, Rajya Lakshmi. Unmute, please.
Yes, sir.
Yeah, share your experience.
Yeah, this letter for me, it's a different letter. I have written many letters, but it's that's why I want to learn something for
Yeah,
like
you
this.
wrote nicely. Whatever you presented, you presented. There are some more mistakes also. I see, for example, hypertension. Why capital letter? Like that.
Okay, sir. Surely capital letters I will see
Okay.
it, and then I will improve my sentence.
Okay. You have improved a lot. I can tell you, you have improved a lot. First of all, I liked your presentation, but still you have to improve. Don't think that it's excellent. Okay. It's
No,
not
no,
very
it's no, sir. It's low only. I will not think.
you
Yeah.
have to improve still. See capital letter unnecessary.
Okay,
So
sir.
like
Sure. I will follow up what you have given. Suggest me. I will follow for the.
okay, fine.
Okay, thank you, sir. Sir, I
Right.
sent one letter. Can you explain that letter?
Which one?
Actually, I sent same along with that one of the social worker only, that one also. I sent through WhatsApp. Can you
Okay.
take for that class?
Tomorrow you are working or free?
No, evening duty, sir.
Evening duty. So tomorrow evening duty means morning you remind me. Okay, I'll schedule the session. Okay.
Okay, sir. Sure, sir.
Because I'm in the middle of corrections now, I cannot schedule now. Morning before 12 o'clock you schedule. So tell me, remind me, I'll schedule that session and I'll express that later. Okay.
Okay, sir. Okay, thank you, sir.
Okay, dear.
What about my speaking, sir?
Speaking, actually today that trainer was not available. Maybe because she has some health problem. So I will take the speaking. No worry. Okay, you are free now. You are
Yeah.
free now, right? You don't have duty right now, right?
No, sir. So no. Until
I can
tomorrow
take your
afternoon,
speaking
where
now.
I am free.
I can take your Laraib. I will correct your letter after where is Tricia? Tricia. After Tricia, I'll correct your letter. Okay, Laraib? Be
Okay,
ready.
sir. Thank you, sir.
Yeah, tomorrow before 12, you call, message me first. Call me. See that the schedule is done. Fine? Okay. Tresia. Hello, Tresia.
Yes, sir.
Thank you for your patience, dear.
It's okay, sir. Even I was listening to the others' correction and helping myself.
What this Simon sir is so angry, you are thinking maybe. I'm not angry. Okay.
No, sir.
My voice is like that, my tone is like that because I am teacher. Nah? Command, that's all, not anger. Command. So Laraib. Hello, Laraib. Hello, Laraib.
Hello, sir. Good
There
evening.
is a one Rakhil. Rakhil. Martab, Rakhil. What's name? Barkat. Rakhil Barkat. She's also from Pakistan. Where are you from, Laraib?
From Lahore,
Karachi
sir.
or Lahore?
Lahore.
Lahore. Okay, okay. So Rakhil is here. Okay, Rakhil, unmute. Where are you from?
Sir, I'm from Karachi.
You are from Karachi. Okay, see, Pakistani students are there. Pakistani students love me like anything. You don't know. There are many students. I have a big fan following in Pakistan. Group of students are there. There are two groups of Pakistan. My batch. Two groups are there to follow regularly. Okay, right. So, Tresia, now it is your turn. Next, Lara, tell me which letter I should correct. You can send it.
Sir, I already sent in your WhatsApp.
Okay, I will take it now. Okay, after Tresia's letter, I will correct your letter.
Sure, sir.
So this is close file. Save as Rajya Lakshmi round 1. Yeah, that's